My name is Chikwe Ihekweazu. I lead the Nigeria Center for Disease Control in Abuja, Nigeria. So now the state of Nigeria's health infrastructure, I think this has really come to light during the COVID response. We've all come to the realization that our health infrastructure across all levels actually are not in a state that we can be proud of. From our primary healthcare centers to secondary healthcare to tertiary healthcare. We did a survey at the beginning of the outbreak to assess the number of intensive care units and intensive care beds properly equipped that we had in the country. There were less than 300 for a population of 200 million. So I think across the healthcare sector, private, public, state, federal, we're definitely not where we want to be. I think one thing that has happened due to COVID is that challenge that many of us in the sector have been very much aware of for many years has now come to light for many other people in society that may not have been acutely aware of the state of health sector infrastructure. And because there was nowhere else to run to during the outbreak, I think everyone now realizes that there's an acute need to fix our health care infrastructure, at least start a trajectory towards getting it to a state that we can be more proud of. So, once we faced this incredible outbreak in Nigeria, part of a global pandemic, we obviously reached out immediately to corporate Nigeria. And, they really responded and collaborated with us. But I think the most important thing that happened in Nigeria was the coming together of the private sector. The organized private sector came together and themselves formed a coalition called CACOMID. And through this coalition, they started engaging with us and defining ways to support the work that government was doing, supporting the rapid establishment of treatment centers in many states across the country, worked with us to support the direct delivery of services in certain cases, supported our public health laboratory infrastructure. But the key thing is that rather than negotiate with 20, 30 different big companies, they came together, pooled their resources, and engaged with us together. And that really was the defining difference in how the private sector came together. That enabled us really gain a lot more benefit from this because of the scale of that engagement, and brought benefits both to the public and private sector by the scale and collaboration we had in this relationship. And so that's been great. And that relationship is now growing, and we hope that it will continue way beyond the pandemic and really form a model in terms of how the private sector is engaged. The other thing, your second question is how public health organizations have grown and driven the response. This is what we do. An organization like the Nigeria Center for Disease Control, for instance, would not have been well known in Nigeria. Was a relatively small parastatal, normally sit in front of our computers or looking into the microscope, trying to define what infection is causing, what bug is causing disease in individuals. But really, I think this outbreak has really brought to the public consciousness the role that we play in protecting the health security of all Nigerians, and why it's important to invest in the type of work we do. But we look forward to going back to the quiet work and quiet life that we had, really working behind the scenes and making sure we carry out the surveillance, laboratory detection, emergency operations when necessary. But really, we would much prefer to work behind the scenes, ensuring that Nigerians are safe from public health threats. Yeah, so because it's such a big country, at the Nigeria Center for Disease Control, we manage the supply chain from everything we buy or get donations. We have a warehousing infrastructure to manage that at the national level. Then we distribute to the states and priority health tertiary hospitals. The further distribution down to the primary healthcare centers and smaller hospitals would now be done at the state level. You know, previously we had a small warehouse, we distributed commodities occasionally. What we had to do was scale exponentially during this response. In the beginning, we were lucky just last year to have implemented a supply chain software management, information management system to manage both our procurements and our distribution. If we had not made that investment, we would have been really in a terrible situation as this outbreak hit us. So we have in Nigeria, through the Nigeria Center for Disease Control, a supply chain management unit, both in terms of procurement, warehousing, distribution, monitoring, projections, models, and all of that brought together. But we're learning a lot from the private sector and how to do this more efficiently to manage, you know, the last mile, especially distribution, so that we don't have too many losses. The unique thing with when you're doing supply chain management for the type of work that we do is that every product has a expiry date, sometimes very short shelf life. So we've got to manage that very carefully, buy enough to provide the resilience, but not too much that there's a lot of waste. And it's in finding that balance, it's something that we're continuously juggling here at NCDC.